Good afternoon and welcome to this edition of Personal Wealth Strategies Speaker Series. Today we have our guest speaker, Dane Milan, is going to be speaking to us about Medicare and supplemental insurance. Before we introduce Dane, I want to first make a note that today's session will be in audio mode only, so you'll be just looking at our logo as the video for today's session. With that, I want to introduce Ed Schuler, who's our newest associate, who will in turn introduce Dane.
Thank you, David. I've known Dane Milan for a few years now, and I know Dane's been in the industry for about 18. And the way I look at Dane, he is the master of Medicare supplements. He has an office in Shrewsbury, New Jersey. He's been doing this quite some time, and he knows, I would say, almost everything there is to know about what is happening in the industry and what is going to happen in the industry. So with that in mind, I'd like to turn the microphone over to Dane and let him start his presentation. Dane?
Thanks, Ed, and thanks, Dave, for having me here. I'd like to thank Personal Wealth Strategies, which is down here in Hamilton, New Jersey. We're here to talk a little bit about Medicare. I mean, it's kind of a moving target. It's on everybody's plate, if you will, if you are Medicare eligible. It's the time of the year where they have what they call annual enrollment. So there's a lot of sideways movement with Medicare. There's a lot of talk down in Washington about what's changing for next year, what's not changing for next year. If you are Medicare eligible and you live in New Jersey, just as an example, you're being pounded every day in the mailbox with solicitations, with things that look like they're government information but are probably solicitations. But we're going to talk about a few things about Medicare, just to give everybody kind of a basic primer. You know, you believe that starting with a good foundation always leads to good results. So we're going to talk about Medicare and just a couple of its parts to start. Medicare Part A, which is hospital insurance, and then Medicare Part B, which is medical services. If you have a Medicare card and you look at your card, it's going to have your Medicare A date, your Medicare B date. It's going to have your name. It's going to have your Medicare identification number. There are many of those, so the numbers can be different. The letters can be different depending upon your enrollment circumstance. Your Medicare A and B effective dates may also be different for a variety of reasons. But what we're going to talk about basically is Medicare. Forget the dates for a second of when you enroll, but just Medicare, assuming you have Medicare A and Medicare B. First, we're going to talk about Medicare Part A. Again, Medicare Part A is hospital insurance. What that means is when you are admitted into a hospital or admitted into a skilled nursing facility. First off, Medicare has what they call a benefit period. And the numbers, the dollar amounts I'm going to talk about today are going to be 2015's numbers. Each year these numbers can go up, but we're going to talk about 2015's numbers for today's discussion. So your Medicare Part A deductible is when you are admitted into a hospital. Admitted into a hospital means that, God forbid, you go to a hospital and you're seen in an ER and not admitted. That's a Medicare Part B function. But if you go in and you're sitting there because you've got an elbow that's bothering you and they decide that they want to keep you and they admit you into a hospital, that's when it becomes Medicare Part A. Each time you're admitted into the hospital, the first 60 days, or days 1 through 60, is what Medicare refers to as a benefit period. For each benefit period that you have, Medicare requires you to pay a $1,260 deductible. Your 61st through your 90th day, consecutive day in a hospital, Medicare requires you to pay a $315 per day copayment. Your 91st through your 150th day in a hospital, Medicare requires you to pay a $608 per day copayment. Your 91st through your 150th day are also what Medicare refers to as your lifetime reserve days. You only have lifetime reserve days once in your life. When you use those lifetime reserve days up, they cannot be replaced. After your 150th consecutive day in a hospital, so in other words, day 151 through whenever, your Medicare Part A benefit stops and you're responsible for all your costs. Skilled nursing confinement. Skilled nursing confinement is when you are released into a skilled nursing rehab facility after you have been admitted into a hospital for at least 3 days. Medicare will only cover the first 20 days at 100%. Days 21 through 100, you have a $157.50 per day copay. Believe it or not, that's Medicare Part A in a nutshell, kind of the Reader's Digest version. It's a little scary. Some of the folks out there that are listening to this right now often say, I thought Medicare would have been better for me than what I'm hearing. It gets better because they also make insurances that fill in what they call the gaps or Medigap insurance for your Medicare A and B. So that wraps up Medicare Part A. Now we're going to talk about Medicare Part B. Medicare Part B, again, is medical insurance, medical services. It's anything other than being admitted into a hospital, but not maintenance drugs. Maintenance drugs are things like Lipitor or Coumadin or anything like that. So first off, Medicare Part B is a calendar year program, meaning January 1 through December 31st of each year. 2015's Medicare Part B deductible, which means that you would pay this deductible yourself before your Medicare Part B benefit would commence, is $147. Those are for things like physician services, inpatient and outpatient medical and special services, surgical services, physical speech therapy, diagnostic testing, things like that. You pay the first $147 per calendar year. After that, it's kind of the old 80-20 rule. 80% Medicare, 20% you. So just as an example, if you went to a doctor's office and it was the beginning of the year and you had not met your $147 per year Part B deductible, you would pay the first $147. So if the doctor's office visit was $100, you pay that $100 before Medicare would kick in. But let's say that it's after that. Let's say you've met that $147 deductible through a variety of visits to the doctor, or maybe even an emergency room situation, because that's Medicare Part B, not Medicare Part A. And you go to a doctor and the bill is, say, $100. Medicare would pay $80 on your behalf and you would pay $20. That's of the approved amount, by the way. That gets a little tricky, but for easy math over the radio and without visuals, we'll just pretend that the bill was $100 and Medicare covered 80%, which was 80, and you covered 20%, which was 20. And there's no limit on that, by the way. There's no what they call maximum out of pocket on this. You would pay and pay and pay 20%, 20%, 20%. Clinical lab services, which are blood tests, things of that nature, generally Medicare covers those at 100%. One of the things that we've seen in the market in the last couple of years that folks would kind of want to pay attention to is if you go and have lab work, what you want to do is you always want to ask, does Medicare cover this? Because if Medicare doesn't cover a specific part of lab work or blood testing, you'd be responsible for that, typically 100% of what that excess charge would be. Home health care. Home health care is part-time or intermittent skilled home health care, not to be confused with long-term care, which is a completely different situation. But part-time or intermittent skilled home health care is, let's just go ahead and say you had surgery done on your knee as an outpatient, which would be a Medicare Part B function. You went home, but you had sutures that needed attention or wound care, and the doctor ordered 3 days a week for the visiting nurses to come by. That would be an example of home health care. Those services are covered at 100% of the approved amount. Now for durable medical supplies, which are canes, crutches, walkers, wheelchairs, things like that, Medicare covers 80% of the approved amount, leaving you responsible for 20% of the approved amount. The next little feature we want to talk about in Medicare Part B is outpatient hospital treatment. Outpatient hospital treatment, again, means that you either go to a hospital and are seen but not admitted. So what's an example of that? Maybe going to the hospital for an x-ray or a bone density scan or orthoscopic surgery on your knee, an epidural. Any of those things where you're not admitted into a hospital is Medicare Part B. What happens there is that Medicare's reimbursement rates to the hospital are based on a scale. You could be responsible for co-insurance on that. Again, let's just go ahead and use 20% as the example that you would be responsible for, and 80% on Medicare that they would be responsible for. On a $1,000 bill, easy math says $800 Medicare, $200 you. There's also room in outpatient hospital treatment or in a doctor's office visit that is what they call Medicare Part B excess. Part B excess can really occur in two ways. One, if a doctor accepts Medicare but does not accept assignment, and assignment by definition is the Medicare approved fee schedule, a doctor can charge 15% above an approved amount. So even if your doctor accepts Medicare but does not accept assignment, and remember the $100 example that we used a few minutes ago, if you went in and it was a $100 visit and the doctor didn't accept assignment, the visit would become $115. $80 would be Medicare, which is 80%. $20 or 20% would be you. And the $15 or 15% on that $100 would be considered Part B excess and would also be you. Part B excess is something you always want to keep an eye on because it could cause your costs to soar. Blood. After the first 3 pints of blood, then 80% of the approved amount is covered by Medicare and 20% for you. This is a basic primer on Medicare Part A and Medicare Part B. Certainly there are many other things that we could talk about, but this gives people the foundation for Medicare Part A and Medicare Part B, which commonly is referred to as traditional Medicare. Not a Medicare Advantage plan, not any sort of Medicare HMO or managed care at all. But what we're going to do now is we're going to talk about really one of the most common plans that's out there. And either you're Medicare eligible and have it, or you're becoming Medicare eligible and know somebody who has it. We're going to talk about a very common plan just to show you how Medicare supplemental insurance fills in the gaps of Medicare. And we're going to talk about today the Medicare Supplement Plan F like Frank. The Medicare Supplement Plan F like Frank is offered by many carriers. We happen to be sitting in the state of New Jersey, so we'll talk about New Jersey. There are many other states with many other varieties of plans, but these are all basically what they call the alphabet soup. These plans are available in really every state in the United States. But again, for our discussion today, what we're going to talk about is the Medicare Supplement Plan F, because really most people are familiar with the Medicare Supplement Plan F. You can move away from the Medicare Supplement Plan F and go all the way out to what's called the Plan N and all the way down to the bottom or the basics, which is a Medicare Supplement Plan A. But we're going to talk about a Medicare Supplement Plan F. Again, tough without a visual, but it'll show you how Medicare supplemental insurance works. If you remember, we talked about Medicare Part A, which is when you are admitted into a hospital. We're going to talk to you about how Medicare supplemental insurance, and particularly the Plan F that we're referring to today, fills in the gaps. That $1,260 Medicare Part A deductible for each benefit period, regardless of how many benefit periods may surface, is covered at 100%. That $315 per day copay for days 61 through 90, as well as the $608 per day copay for days 91 through 50, are also covered at 100% with the Medicare Supplement Plan F. In the event that, the unlikely event, that you use up all of your lifetime reserve days, which is at day 91 through 150, a Medicare Supplement Plan F gives you an additional 365 days of complete coverage in a hospital if necessary. Skilled nursing confinement, we talked about that earlier. Skilled nursing confinement, again, is when you're released into a skilled nursing rehab, after which you've been admitted for at least 3 days in a hospital prior to that transition into skilled nursing. The per day copay for days 21 through 100 of $157.50 per day is covered at 100%. So basically, in a nutshell, and I hope you don't ever need it, but if you get laid up in a hospital for a long period of time, there's a good chance a Medicare Supplement Plan F will cover most, if not all, of your expenses associated with a hospital stay. Now we'll move over to the Medicare Part B side. The Medicare Part B side, again, really the easy way to remember Medicare Part B is it's everything other than being admitted into a hospital, but not maintenance drugs. So again, we're talking about doctor's office visits and things like that. First off, the Medicare Supplement Plan F covers that $147 per year calendar deductible for Medicare Part B. It's covered at 100%, meaning that your plan will cover what Medicare doesn't from January 1 through the end of the year, keeping in mind that Medicare always has to pay first. That's the only way a Medicare supplement policy will work, is if Medicare pays first. So, after the 147, if you're going to see Dr. Smith, this week and Dr. Jones next week and see a different doctor every week for the next 12 weeks, the 20% of the approved amount that Medicare doesn't cover, the Medicare Supplement Policy Plan F will cover. In the event that you needed canes, crutches, walkers, or wheelchairs, and Medicare paid their 80% and there was 20% left over, this policy plan F would pay for that also. Outpatient hospital treatment. Again, that was a biggie. Outpatient hospital treatment could be a series of procedures, could be even on the bad side, chemo, radiation, anything like that that would take place as an outpatient. Keep in mind also that some doctor's offices have outpatient facilities attached to them as well. The 20% that's not covered there, the Medicare Supplement Plan F would cover that also. Plan F also covers that Part B excess. We talked about that before. Medicare Part B excess is if a doctor does not accept assignment, which is the approved Medicare fee schedule, they can charge you 15% above that approved amount. The Medicare Supplement Plan F covers that at 100%. Also, Medicare Supplement Plan F covers foreign travel emergency after a small deductible if you're in a different country and God forbid you're sick. Based on what the reimbursement rates would be in the United States, you submit your paperwork when you get home and you'd be reimbursed at 80-20, 80% them, 20% you, up to $50,000. That's it for Medicare Supplement Plan F. Now, of course, there's certainly more details to talk about, but as an overview or an outline of coverage, I've just described to you what many of you would see in your mailbox this time of the year if you're Medicare eligible. You'd see some of these plans being offered to you for sale. Medicare supplemental insurance policies are sold by insurance companies. Although all the benefits have to be the same, all the premiums do not. The service does not. So there's many different ones to look at. So please always make sure that you look at every detail possible on supplemental insurance, including the carrier, including the people that are selling it to you, or including the people that you're talking to on the phone. There's a lot more than what we talked about today. I would encourage you to talk to any of these folks over here at Personal Wealth Strategies. And if you ever wanted to talk to me, they could get you to get in touch with me. I'm a good guy calling people back. So that kind of wraps it up on the supplemental insurance. There are other components of Medicare that we're not going to talk about today because there's a lot of sideways shift in the market. Those are Medicare Advantage plans. Those require an awful lot more time and discovery than what we would have time for here today. And Medicare Part D. Medicare Part D is prescription drug programs. Medicare prescription drug programs are kind of the moving target in Medicare on an annual basis, where they change each year. Their premiums change. Their deductibles can change. Their co-insurance can change. Your out-of-pocket can change. There's a lot to look at with that. Again, would be left for another time and another discussion, but certainly reach out to these folks and do your due diligence when you look for a plan anywhere in the United States. Make sure that you're looking at it real closely. So now I'm going to sit here and I'm going to just chat for a couple minutes with my friends Ed and Dave, and we're just going to try to figure out how much else to talk about on Medicare here. And I hope that I helped. I appreciate you taking the time to listen. If you're a YouTube listener today, you are a YouTube listener today because there is no visual with this. But thank you very much. So now we're back here at the table with Ed and Dave.
Dane, let me ask you a question. How often should somebody review their Medicare sub plans to make sure that the rates are in line? If you're comfortable with the specific carrier and you're happy with the coverage and things of that nature, how often should you look at the rates?
It's kind of, here's what we like in this too. You know that if you've got a smoke detector in your house and you change your clock forward or spring forward and fall back, you change your batteries and your smoke detector. Kind of the same thing with Medicare. When you get into Medicare's annual enrollment period, which happens to be coming up on us, it's October 15th through December 7th of each year. Although the bigger focus that time of the year is to review the benefits and features of your Advantage plan, which is a Medicare HMO, or your Medicare Part D plan, which is your prescription plan. At that time, it's not a bad idea to take a look at your Medicare supplemental insurance policy at the same time. However, you need to keep in mind that in most states, New Jersey we'll talk about for a second, you can change your Medicare supplement policy any time of the year. Typically, those are calendar year or plan year rather, commitments. So if you buy one from a big name insurance company and you got it in April of last year, usually their commitment to you is on a 12-month basis. 12-month basis meaning April 1 through, say, March 31 of the following year. But it's a good idea to look at this stuff once per year. It's beneficial to the consumer. There are times when you can move easily and times where you might not be able to move easily. And a definition of that might be somebody who's on claim. If you're on claim, meaning you're not well, if it ain't broke, don't fix it. If the plan is working, if it's paying its claims the way that it should, if you have a broker and you're letting your broker know that you might need them, or a family member, you might need their help with that, kind of leave everything the way it is. The less that you do at that point, the better. But on an annual basis, definitely you want to look at your Part D plans during the enrollment period, which is now.
Is there medical underwriting if you were changing from one plan to another plan?
Good question to ask. And you know something, I'll address that specifically only to New Jersey because there are other states that have what they call rolling open enrollments. New Jersey does not. So we'll talk specifically about New Jersey. Anybody that wants to ask any more, they can call in and ask you guys and get a read on the state they're talking about. But New Jersey only is that if you're in your open enrollment, and your open enrollment is really when you're first becoming Medicare Part B eligible, B like boy, there's no underwriting, there's no pre-existing condition clause, there's no waiting period or anything like that. In that situation, you go into a plan, whatever plan you pick. If you wanted to move, let's make you 67 years old, and you want to move from a plan N to a plan F, in a lot of cases, each carrier is specific. In a lot of cases, there can be underwriting. Some plans don't have underwriting. It's kind of carrier specific, but people should count on some degree of underwriting when they make a move from plan to plan, just so they're prepared for it.
So the important thing then would be to pick a plan that you want based on the fact that you may have a claim during the year.
That's exactly right. Let me tell you what people look for, and this is what people should program for. In Medicare supplement insurance, Medicare Part D, again, there's that annual no harm, no foul. You can move from one to the other because you find out that they took a drug off the formulary, they changed the tier structure. But much like you guys do in personal wealth strategies, look for the long term. You know, anybody that wants to gamble with their health insurance on an annual basis, go buy a roll of quarters and go to Atlantic City. You want to pick something that is predictable, something that is budgetable, and something that in most cases is affordable. But you really want to have a multi-year marriage at a minimum with your supplemental plan. And I kind of said that when we were talking about plans in general, is that, you know, do the research on them. Find out what the history is on the plan. Find out, I mean, geez, if you're getting it from a broker or an agent or even somebody on the phone, what's their history? You know, dig a little deeper. This is an important decision. You know, when folks get a little older, they certainly have a greater chance of using their health insurance than a 25-year-old that is Superman or Superwoman. You get a little older, it's pretty much a statistic. You're going to use your insurance a little more. So make a good decision and make a reasonable commitment. I'm not necessarily saying a long-term commitment, although I know people that have been in plans for 15 years. You couldn't drag them out with a team of horses because they have a great relationship with their carrier, where the carrier, without question, has paid their claims. But you want a long-term commitment. You really do.
Now, we talked about getting into the right plan, but there's penalties if you don't get in at the right time.
There are. I mean, you know something. Some of the bigger pitfalls, and anybody out there that's listening, this would apply to them. You know, there are federal rules that come into play, and not to talk in depth about them, but you know, if you're not collecting Social Security, but you need your Medicare Part B, and an example of that is that you're maybe working for a small company, which in the eyes of the world of what they call who pays first is under 20 lives, or you're getting ready to retire and you never got your Part B, you really want to pay close attention to that, because if you don't get what you were supposed to get when you were supposed to get it, then yes, there can be penalties. There can be penalties on your Medicare Part B. There can be penalties on your Medicare Part D. There can be enrollment delays on your Medicare Part B, Part D, based on what the circumstances that delayed you into even discovering that you needed it when you didn't. You know, always stay in touch with Social Security if you think you need to. I think they're probably some of the best people that are out there. They're passionate to your needs. They're skilled. They're seasoned. And talk to a broker too once in a while about the plans. Social Security is not going to talk to you about plans. They're going to talk to you about your enrollment circumstance. And just because your neighbor has one plan doesn't mean that's a plan for you. Everybody's kind of a snowflake when it comes to that. You really, really should do a reasonable amount of homework on this stuff. It's no one size fits all.
Now, just to be clear, you used the expression before, alphabet soup.
Correct.
Right.
The alphabet soup. When I talked about the alphabet soup, what I was referring to was traditional Medicare supplement policies as they exist today. Not 20 years ago, not 10 years ago, not 7 years ago, and certainly not 5 years from now. Right now, what's available in the United States of America, we'll talk about New Jersey specifically, is a plan A through N. So you have A, B, C, D, F, no more E, G, K, L, M, N. There used to be a J. That was probably one of the most popular plans that was out there. You may have a neighbor, a friend, a mother, a father, a sister, a brother that had a plan J. The sun set on the plan J being available for sale as a new plan in June of 2010. So that hadn't been around for 5 years, 5.5 years almost. But that truly was the gold standard at the time. There are plans that have come and gone. There were plans prior standardization, which was back in the early 90s. We don't see so many of them anymore because, unfortunately, a lot of those people were old then, and they got older and they passed away. But the plans that are out there, that's the alphabet soup. Right now, it's A through N.
And just to clarify, Medicare Supplement Plan A is not the same as Medicare Part A.
That is correct. A lot of good question asked. A lot of people come back and they say, "Oh, well, I have an A." Well, do you have a Plan A? No, I have an A on my card. Oh, well, what's your supplement? Oh, I think it's a J. Oh, okay. Well, look at your card. But it's confusing. The A to B. There's a supplement Plan D. In New Jersey, the most popular plans that are around are the C, the F, and really now the G, which is probably another show at a later date because it would take a while to discuss why we would say the G is gaining in popularity versus the F or even the C. But exactly. The A, and a lot of people say, well, I have C. Well, Medicare Part C is Advantage plans. Medicare Plan C is not an Advantage plan. So good. I mean, again, a lot of smart people out there, but it can be very confusing to the layman.
And as confusing as it is, there is a website that someone could go and do their due diligence.
Absolutely. The Medicare website is consumer friendly if you know how to use a computer. And that website is www.medicare.gov, G-O-V, not .com. I'm sure that's a solicitation site somewhere, but medicare.gov. And also a couple other good resources too are your county social services board. They usually have great volunteers that are out there that can help give you a little bit of guidance. But look for some of the pros out there. There are a lot of really good ones out there in New Jersey and of course across the country. But but trade on the people that have the history and the knowledge. Ask a friend. Usually a bunch of Medicare eligibles have other friends that are Medicare eligible. Ask them what they did. And pay close attention during the enrollment time of the year too, which is, we're coming into that now.
Okay, so Dane, if I'm looking for a Plan C for the sake of discussion, and I come to you as an expert in the field, okay, and you told me Plan C is the same from carrier A, B, or C.
Correct.
The pricing is going to be different.
Correct.
Okay. So naturally, as a consumer, I'm going to say, well, give me the one that's the lowest price.
Not always the best deal, though. What you want to find in insurance, whether it's health insurance, homeowners insurance, car insurance, you want value. You want value in what you do. I mean, again, I would never say anything bad about a carrier or anybody else because I just don't think that that's fair. But there are carriers that come in with a come-on rate, and the come-on rate is they'll take anybody so long as there's a breath. And not have a little bit of underwriting. I'm of the old school insurance where, the harder a carrier is to get into at the onset, the lower the rate is going to be over a longer period of time. I mean, we all sit here right now. I mean, we've been on the planet for a long time, and I have car insurance, you have car insurance, Ed has car insurance. I think I'm a pretty conservative driver. I wouldn't want to go get car insurance with a bunch of 17-year-old kids in New Jersey with little Toyotas and fat mufflers. That's just not me, because I think that I have less of a chance of having an accident. Not good. Whereas younger guys and driving around, with they might. So same thing in insurance. You want to look a little deeper than just what that front sheet is. Glossy sheet with again for 2, 3, 4, 5 years. You predict insurance. I think is easier. The carriers you're looking at, you underwrite as aggressively as others.
And then there's obviously some large association plans out there too, where people can go because of the size.
The size matter, but when you look at association plans, certainly. But association plans, some of the association plans, if you're a member of the association, you can get into the plan. Again, it's not underwritten. I mean, you want to try and find a plan that's harder to get into maybe than somebody else's. But association plans certainly are an excellent alternative. There are a lot of them that are out there. But that brings you back to if you go to an association, how many plans are going to show you? They're only going to show you theirs. You go to a big box plan, who are they going to show you? Only theirs. You go to a broker, and a broker's got skin in the game. A broker wants to show you something that's going to work for you for the longest period of time, because a broker wants to work for you, and it doesn't cost anything to have a broker. Insurance companies pay for brokers. So in your discovery process, not saying it's the only way you should go, but in your discovery process, talk to a broker, and talk to one that doesn't do it as a hobby. Talk to somebody who knows what they're talking about. That maybe wasn't in another line of work 4 months ago and is going to be in another line of work 4 months from now. Talk to a professional. Professionals are always going to give you the best advice.
And then final question from me. We're talking all about the front end. Let's talk about the back end. And from a service standpoint, do you find that there's a difference in the service that different carriers offer?
Absolutely.
And is that important to know before you start?
That's huge. You want to be able to. You want something that's predictable, and you want serviceability. You want somebody that's going to say to you, "I want to help you if you have a problem." Because if you're single and you're a little older and you're on claim, who are you going to call? Who wants to sit? One of the things that drives me crazy, and probably a lot of other people too, is who wants to sit on an 800 number for 25 minutes pressing buttons, whether it's press a button to go here, there, talk this, talk that. A broker's going to give you that. Brokers will service what they sell. And again, it doesn't cost you anything to have a broker. And you want to ask that question. That's a real good question to ask. And ask a broker, are you going to service this if you sell it to me? Yes, I am. Well, that's probably pretty somebody good. Versus, no, I want to give you the cheapest thing that's available and I never want to hear from you again. Where I am, where I work and what I do, I want to hear from my clients. I really do, because I meet everybody that I insure. And I know them, I know their families, and me personally, I like people to call. I don't really hear from people much because what we recommend works, so we don't hear from them. But we want you to call always. But that's great. Yeah, service is huge. Some people are cut out to try and do everything on their own. We're talking about something pretty serious here. We're not talking about changing the tires on your car. We're talking about your life. And last time I checked, mine mattered a lot. And the last thing I want is to be talking to anybody who doesn't care, who I can't find. You want the service that you're really entitled to, not what you're paying for, what you're entitled to.
I would agree, and that's something that I think is so critical. Dane, I thank you for coming in today and holding this presentation. I think for everyone listening, they now know why we picked Dane to do this presentation, because he's clear. He's knowledgeable, and he's someone who is a great resource to us, to Ed and myself, and to all our clients. So thank you, Dane.
I want to thank you guys for having me. It's a great opportunity, great day here in New Jersey, and call these guys because they can find me if you need it. So, and thanks, Ed. I've known Ed for a
thank you,
long
Dan.
time, and I appreciate his support too.
And I think one word that Dave left out of the description of Dane is he's passionate about this industry, which you don't see too many individuals that are that passionate. So with that in mind, thanks again.
Thank you.
And as we conclude our presentation for today, I just want to remind everyone that our next presentation will again be on the second Wednesday of the month, as they always are. We have, I think, a pretty exciting presentation on November 11th, which will be Veterans Day. We have Claire Lawless coming to speak to us from the Iraq and Afghanistan Veterans of America, who's going to be talking about transitioning veterans back into society, back into civilian life, and what we as the populace can do to help them. So I hope you can all join us for that session, and it will be recorded and posted up on the website so that you'll be able to watch it at your convenience, but it will be live on November 11th, Veterans Day at noon. Thank you all for joining us today, and have a good day.